Hi everyone. In this video, I am speaking about vision awareness in children and it's a message for the parent. Myself, Dr. Shweta. First of all, let us know there are some facts about child's vision. Many school age children are far-sighted. This is most common between 6 months to 6 years or even between 5 to 17 years of age. Most of the time, it goes unnoticed as children's eyes have an ability to adjust the eyes and see clearly. The causes of farsighted could be either genetic or any disease in utero or even malnutrition. Next element is limiting the screen time. If we can limit the screen time, we can lower the risk of myopia or eye strain. Many vision problems go unrecognized for years. The child have an ability to focus for distance or even for near work with a strong accommodation. Vision problems can lead to learning disabilities. Next is color blindness. Color blindness, the most common entity in color blindness is red green confusion, which also goes unrecognized for years. Sports are the main cause of eye injury and which are preventable with a proper protective eye wears. Monitor the contact lens care in children. Never let the child to handle their contact lenses themselves because contact lens induced eye diseases like keratitis or even trauma are having worst complications. So, a parent must monitor the contact lens care in children. Keeping the cleaning products away from the children. Cleaning products could be either phenol, harpic, acids, or even soap waters kept in the household setups can harm the eyes badly if they are spilled into eyes. So they must be kept out of reach of the children. Attention should be given at different ages with respect to child's vision. At infancy, infancy means till the baby attains 1 year. Next, from second year till the school going age, the baby is called as a toddler. Then, at school going age till 5 to 12 years of age, the attention will be different. And next, in teens and adults, also, there are some facts which a parent must concentrate with respect to the vision care. Let me tell you one by one. At infancy, before the pregnancy itself, our parents must quit smoking because the smoking can lead to premature births. Premature births means the baby will be born before the 9 months of the pregnancy. If the baby is premature, then it is likely to have the vision problems. So, as much as possible, the parent must be conscious to avoid the causes which may lead to premature births. Next, at first month of the baby's life, the central vision is yet to develop. Once the central vision is developed, a baby can focus an object right in front of him. At 3 months of age, a baby can focus and follow the object means the central vision is completely developed by 3 months. In first 2 months of age, the eyes appear to cross over or wander out, which is usually normal at that time. If it continues, then that must be addressed. This wandering eye must be settled by 3 months of age, and the central vision must be developed by the same 3 months of age. Once the eyes are not wandering, or once the central vision is developed, a baby can follow a object or even track a moving ball or any toy. This image says about the color vision development. At newborn, when the baby is just born, the vision will be very blurred and only black and white color range a baby can appreciate. At 1 month, 8 to 12 inches distance, till 8 to 12 inches distance, a baby can follow a blurred vision, and the color vision yet to develop by first month. Means the visual range will be still black and white only. By 3 months of age, a baby can start to recognize the colors. It's at 5 months. 3D vision will develop. 3D vision, three dimensional vision means a baby can follow a moving object and he can recognize at what distance, exactly at what distance the object is, and can will try to reach that far object just in front of him. By around 9 months of age, the eyes turns to its normal final color. For the color of the factor which determines the color of the eye is the melanin pigment. The melanin, it's a brown pigment in the iris which determines the color of the eyeball, and it is attained by around 9 months of age. At toddler age, a parent must watch for misalignment. Misalignment means one eye will be seeing straight, other will be wandering out or in or up or even down. Get all vaccinations on time. For example, if vaccination for measles is not given at right time, just the measles virus can harm the eyes. Measles is a disease having some eruptive disease. There will be some eruptions all over the body, and in this disease, even this measles virus can affect the eyes. Just it may cause even the conjunctivitis or some of the most complicated complications of measles virus could be even optic neuritis. Sometimes even the measles virus can lead to blindness also. So it is must to get the baby vaccinated on time. Keep away the household cleaning products, as in toddler group the toddlers are most ambulant and curious, roams everywhere in the body, and they are very keen to explore the hidden things in the home. So as I highlighted in the previous slides only, the household cleaning products must be kept out of the reach for children. If chemical injuries happens, what to do? First, flush the eye with a plenty of water, plenty of clean drinking water. Then reach the nearest eye care center. Never wash the eyes with a hot water. Just the clean, normal temperature water is enough. Then don't rely on the home remedies. Just reach the nearest eye care center, because the chemical injuries, as early you attend, the complications will be lesser. Watch for the lazy eye. The lazy eye will not give you any alarm that it is happening. It is silently disturbing the child's vision. It is also called as amblyopia in medical term, or it is caused by the wandering eye. Wandering eye means the squinted eye. When the eyes are misaligned, or if one eye is a squint or one eye is wandering out, the brain receives two different images at one time from two eyes, which a brain will be confused to combine the one image and perceive it. So brain starts ignoring the image coming from the weaker eye. Then the weaker eye or the wandering eye stops working by itself, which leads to lazy eye. The child loses his 3D vision and he becomes one eyed. The weaker eye goes non functional. Fortunately, it can be corrected. The lazy eye can be corrected if recognized in the earlier time. So, watch for the lazy eye or watch for the squint eye and get it treated. We shall discuss about when a child should be taken for the eye examination. As soon as the child is born, a pediatrician or an ophthalmologist will see for the eye. He will see for misalignment, he will see if the baby has any discharge, or if the corneas are not shaped well, if both the eyes are unique, or if both the eyes are similar or non-similar. Everything a pediatrician or an ophthalmologist will check into. If it is normal, then the next eye examination should be at the age of 2 years. If it is also normal, then at the age of 5 years. If a child needs glasses, then eye checkup is done every 6 months or once in a year. What are the signs of poor vision in a child? A parent must be observing the child when he is holding a reading material so close to his face, or he squints while focusing a distant object or a near object. Short attention span. If the child has visual disability, he will not have interest towards learning. There will be learning disabilities that should be attended. And squeezing the eyes to focus. If the baby or a toddler or a teenager trying to see the distant object with squeezing the eyes, there is an underlying problem called as myopia, and that should be corrected. Otherwise, again, it leads to learning disabilities, loss of interest in studies. Next, if the child is complaining of eye pain, itchy eyes, watering eyes, let me discuss about these in particular. These are also the signs of poor vision or any underlying disease of the eye, and those also must be attended. With respect to vision, there are some common problems, especially in children, are refractive errors. Either it could be myopia, means the baby will have or child will have problem focusing the distant objects in myopia, or he may have hypermetropia where he will be having problem with the nearsightedness. Lazy eye, about what I discussed in earlier slide, which is also called as amblyopia. It is treatable, it is preventable, but it should be recognized in the earlier age. Otherwise, the brain stops working on the weaker eye, and the weaker eye becomes non-working or non-functional. Strabismus, again, which is one of the cause for a lazy eye, it can be corrected surgically or even with the sum of the eye exercises. So, if a parent is observing the squinting of the eye, if the eye is wandering out in or up or down, then that eyeball can be corrected. Please take the child to the ophthalmologist. Then convergence insufficiency, that is difficulty in near focus. The child will not be interested in near works. That's again can be corrected with a proper treatment at right time. Next common entity is allergic conjunctivitis. About this also I'll discuss in next slide. As the continuous rubbing of the eye will lead to change in shape of the corneas. Recently, there is an increase in number of children wearing glasses. The reason could be increase in use of gadgets. Either it could be mobiles, tablets, or any sort of digital screens are increasing the risk of number of children wearing the glasses. We must limit it to half an hour a day. If at all it is given for any education purpose or for the gaming purpose, the time should be limited for half an hour a day. And when a child is given any sort of digital screen, he must be entertained to blink in between. If the child is viewing into digital screens, he stops blinking, he starts staring. So that leads to eye fatigue, and eye fatigue will lead to many of the vision related problems. And nowadays, the children are not allowed to spend their outdoor time at least 1 hour a day. Exposure of the eyes to the sunlight, playing outdoors will relax the eyes. Will the baby will get enough vitamin D3, which will prevent the some of the vision problems in children. What are the symptoms which a parent must be watching closely in a child? Red eye, itchy eyes, discharge from the eye, vision problems we just discussed few in earlier slides, and about the squint. Red eye. Red eye could be because of infection, injury, foreign body, or even some of the underlying diseases of the eye. Infection could be either bacterial, viral, or even it could be allergy. If only red eye or red eye with a discharge, pain, whatever, the red eye should not be treated in home. A child with a red eye must be taken to ophthalmologist because the treatment differs with the different causes. Itchy eyes, as I discussed in allergic conjunctivitis, the allergy could be for the season, like for few children the spring season, for a few children the summer season, winter season. There are some pollen grains, there are some dust particles which are allergic for the eyes. The initially the child will complain of itchy eyes or he will just be rubbing the eyes continuously. It could be bilateral, both the eyes will have this problem. It could be simply the eye allergy or the eye allergy coupled with the allergy of the nose, allergy of the respiratory system also. Initially, there will be only itchy eyes. Next, once the baby starts rubbing the eyes continuously, some months or years will pass, the white part of the eye will start become the dusky red. It becomes the dusky red color. Once the disease progresses, it may even affect the black part of the eye also, where we will be seeing the vernal keratoconjunctivitis, which we call it as VKC, which becomes a threat for the vision also. So, itchy eyes must not be neglected. And it's a treatable disease, just some eye drops and some of the oral medicines an ophthalmologist may recommend you, and it goes off completely. The discharge could be either infective or because of any foreign bodies, or there could be a blockage in the tear drainage system. So, any sort of discharge, either it is watery discharge, or pus discharge, or mucoid discharge, mucus kind of discharge, that must not be ignored. As I discussed, the child may have problem with the near sight or may have problem with the far sight. Sometimes the problem could be with the color recognition. All things should be attended at right time. The squint, I was telling previously, the misalignment. One eye sees straight, the other eye goes with a outward or inward, upward or downward gaze. So the squint can be corrected with some of the eye exercises, glasses, or some of the surgical procedures. If corrected in a childhood only, then the baby will have the vision with the both the eyes. There will be three-dimensional vision. Otherwise, if it is not treated at childhood itself, the baby will lose the one eye, which is weak eye. It goes non-functional. So it must be treated at right time. To conclude, I would like to highlight some of the tips which a parent can follow here. Eat well, giving him a plenty of nutritious diet, plenty of fruits and vegetables, nuts. Get enough sleep. A minimum of 7 to 8 hours of sleep for a school going age child not only helps for good vision, it also helps for memory consolidation. A baby must be allowed to sleep well. Wear glasses when the baby requires, like in case of squint or nearsightedness, farsightedness. Otherwise, the babies will lose the interest in the studies. Use protective eyewear when the children are left sent for the sports. Sports injuries are preventable eye injuries, wherein we can prevent them with a protective eyewears. Then limit the screen time. Half an hour a day is the maximum time which a child must be let to spend with the screens. Then outdoor time. Minimum of 1 hour of outdoor gaming is must for a proper development of the eyes and overall development of the child. Get vaccinations on time. Get regular eye checkups if needed. By this, I'll conclude. Thank you. Thanks for watching.